Dr. Daniel George. I'm a professor of medicine and surgery in the divisions of medical oncology and urology and director of genitourinary oncology at the Duke Cancer Institute. And I'm presenting today on behalf of my co-authors and sponsor on the Upward trial. This was a study of enzalutamide in men with metastatic castration-resistant prostate cancer who are at risk for seizures. The background for this study is based on the fact that enzalutamide is FDA approved and EMA approved and really globally widely available for men with metastatic castrate-resistant prostate cancer based on progression-free survival and overall survival benefits seen in the population. But there was a small risk of seizure witnessed specifically in the men who had prior chemotherapy exposure, but also in earlier populations at a low incidence. Because of this risk, we wanted to explore a broader population of patients who were at perhaps higher risk of seizure to see if that increased, if enzalutamide increased the risk of those events. There had been a prior report, the Truven report, that looked at seizure risk in this patient population, particularly patients who had either prior history of seizure, had brain injury, stroke, or were on seizure threshold lowering medications, and has a overall seizure rate of 2.8 events per 100 years. So that is the background in which we compared to. We studied a similar population of patients, again, with seizure threshold lowering agents, medications, history of stroke or brain injury, or history of seizure. And this was a single-arm study, so phase 2 global multi-center study, 423 patients treated with enzalutamide in the metastatic castration-resistant setting. Patients were followed for a minimum of 3 months on enzalutamide, and the seizure events were looked at in the first 4 months of exposure. And of the 423 patients, 366 patients met that endpoint, were on for 3 months or longer, and were evaluable for seizure events. We witnessed 4 events that were confirmed by a neurologist as a seizure event in that population. And this worked out to be equal to about a 2.6 event rate per 100 patient years, which is similar to the historical control. And so our conclusions were that enzalutamide in this higher risk seizure population still did not increase the seizure threshold or events any further. We did follow patients for other adverse events, and we saw a similar profile to what has been reported with enzalutamide in pivotal trials in terms of other adverse events, including increases in hot flashes, fatigue, and diarrhea.